Many men underestimate the potential their hands possess when it comes to providing pleasure to their female partners. Fingers offer unique advantages over other forms of stimulation due to their remarkable flexibility. They can adjust angles, modify pressure levels, and execute movements that rigid objects simply cannot replicate. This precision makes them exceptionally effective tools when applied thoughtfully and with genuine care. As a specialist in sexual health, I've developed this comprehensive approach to help you create experiences where your partner feels respected, valued, and thoroughly satisfied. The foundation of any intimate encounter rests on two critical principles that should never be overlooked or rushed. First, explicit consent must be established and maintained. Directly ask whether she wants to be touched in specific ways and locations. Keep the dialogue flowing naturally throughout your time together. Second, proper preparation demonstrates respect and prevents discomfort. Ensure your nails are trimmed completely smooth with no sharp edges or rough spots. Wash your hands thoroughly using warm water and soap, paying special attention to the area beneath your nails. Remove all rings, watches, and jewelry that might cause irritation. Have water-based, unscented lubricant readily accessible before you begin. These preparatory steps significantly reduce the risk of microscopic tears in delicate tissue and help prevent potential infections. Quality lubricant ensures every movement remains smooth and eliminates unwanted friction that can diminish pleasure. Female arousal operates as a gradual process involving the entire body rather than an instant response. Begin your approach at points distant from her genitals. Kiss her mouth, throat, shoulders, and arms with varying intensity. Allow your hands to travel slowly along her spine and the outer curves of her thighs. As you progress toward her inner thighs, deliberately slow your pace even further. While she remains partially clothed, rest your palm gently over her vulva through the fabric, then withdraw it completely. Trace the edges of her underwear using just your fingertips. This alternating pattern of approach and retreat increases circulation to the clitoris, labia, and vaginal entrance, enhancing sensitivity and responsiveness for what follows. When she indicates readiness, begin touching over her underwear before transitioning to direct skin contact. Use your fingertips to outline the outer labia and surrounding thigh area with deliberate gentleness. Once she appears comfortable, shift attention to the inner lips. Resist the temptation to immediately stimulate the clitoris directly. Instead, trace gentle patterns around the clitoral hood using extremely light pressure. Experiment with small circular motions, horizontal movements, or oval-shaped patterns. Observe her physical responses carefully. Changes in breathing rhythm, subtle hip movements, or quiet vocalizations all provide valuable feedback about what she's experiencing. These signals guide you toward what works best for her specifically. While every woman has unique preferences, most respond more positively to consistent, rhythmic patterns rather than unpredictable variations. Consider circling steadily around the clitoral hood, traveling from the upper region downward and returning, or creating small figure-8 movements. When she seems to enjoy broader surface contact, employ two fingers moving together. If concentrated stimulation proves more effective, maintain focus with a single fingertip. Incorporate brief verbal check-ins using simple questions. Would you prefer lighter or firmer pressure? Should I move faster or maintain this pace? Would higher or lower positioning feel better? These questions show attentiveness without disrupting the flow of intimacy. Natural lubrication signals arousal, but doesn't automatically indicate readiness for internal stimulation. Always ask explicitly whether she wants penetration before proceeding. If she consents, apply additional lubricant generously and begin with just one finger. Never attempt insertion without adequate moisture. Guide your finger slowly into the vaginal opening and pause completely, allowing her internal muscles time to accommodate and relax. Use a gentle beckoning motion directed toward the front vaginal wall rather than thrusting movements. Fingers excel at providing precise pressure and optimal angles, not rapid speed. Explore subtle adjustments in direction, slightly upward, downward, left, and right, while monitoring her responses. If you detect tension, pause immediately, withdraw partially, or return to external touch until she relaxes again. Approximately 1 to 2 inches inside along the anterior wall, the tissue often has a slightly textured, spongy quality. This region, sometimes referred to as the G-spot area, becomes more pronounced as arousal deepens. Curl your fingertip toward this area using a slow, beckoning gesture. Begin with light pressure and increase intensity only when she explicitly requests it or her body clearly leans into the sensation. Most women prefer steady, rhythmic strokes over forceful ones. Use your free hand to gently hold her hip, caress her abdomen, or continue clitoral stimulation using your thumb. This combined approach often produces especially intense pleasure. If she desires a fuller sensation, carefully rotate your hand and slide a second lubricated finger alongside the first. Keep both fingers curved to maintain consistent contact with the front wall. Internally, employ small arc-shaped movements or repeated come here motions while your other hand continues working around the clitoris. Subtle movements frequently prove more effective than dramatic ones. As arousal intensifies, maintaining consistency becomes more important than increasing force. When she approaches orgasm, her signals will amplify noticeably. Hips pressing firmly against your hand, breathing becoming rapid and shallow, vocalizations growing louder, thigh muscles trembling. Once you discover the specific pressure and rhythm that's working, resist any urge to change it. If she says, right there, interpret those words literally and maintain that precise motion until she reaches completion. Many potential climaxes are lost when stimulation shifts prematurely. Several variations can enhance the experience. Create a V shape with 2 fingers and gently slide the clitoral hood upward and downward without exposing it directly. Perform wave-like motions starting from the outer thighs, moving to the inner thighs, then to the labia, before gliding outward again. This helps reset sensitivity between peaks. Rest your warm palm over the entire vulva area with gentle, steady pressure, which many find calming between intense moments. Place a pillow beneath her hips to tilt her pelvis upward, making the anterior wall more accessible. Always maintain short nails, impeccably clean hands, and ample lubricant. If you touch the anal area at any point, wash your hands thoroughly or change gloves before returning to vaginal contact. If she experiences burning sensations or pain, stop all movement immediately, add more lubricant, and return exclusively to external touch. Sharp pain always requires stopping completely. A warm, stretching sensation may be acceptable, but only if she explicitly confirms this. Following orgasm, continue touching her gently while gradually reducing intensity as her body enters its relaxation phase. Many women appreciate being held close, having their sides stroked lightly, or having their hair caressed softly. Gentle massage along the thighs or belly can also provide comfort. Offer her water to rehydrate. Later, ask one simple question: what did you enjoy most? Her feedback becomes your most valuable reference for future encounters. Remember that not every woman experiences orgasm through internal stimulation, which is completely normal. Many prefer clitoral focus exclusively, while others enjoy blended stimulation. The only reliable method for understanding individual preferences involves careful observation, open questions, and attentive listening. Beyond technique, emotional context profoundly affects pleasure. When a woman feels genuinely secure, admired, and unhurried, her circulation improves, her muscles release tension, and her capacity for pleasure expands naturally. Your hands become powerful instruments for connection when guided by patience, precision, and authentic care for your partner's experience.